fibromyalgia, low back pain, neck and jaw pain, headaches, frozen shoulder, repetitive strain injuries, and much, much more can all be improved by something called trigger point therapy. Now, you may have come across this if you've been to a massage therapist or a physical therapist that practices it. Disclaimer, I'm not a medical professional of any kind. I'm just like you, but I'm someone who had a condition that caused me chronic pain. I've had 2 frozen shoulders. Today I want to talk about trigger points and trigger point therapy massage as a tool to help you manage chronic pain. Hi everyone, welcome to the Free Range Diva. I want to start by saying that I have notes, so I'm going to be referring to them as well as a handbook that I want to show you. But I have had problems with my eyes all summer long, and as a result I still can't. I tried to put in my contacts today and they just stung and burned, and so I'm going to be using glasses, and I apologize if it becomes distracting, but I'll try to keep the use to a minimum. For reference, I'm going to be using try and keep the glare. Okay, this is the Trigger Point Therapy Handbook, workbook rather. This is the book that I used when I first was diagnosed with my first frozen shoulder to teach me the technique, and it's designed for the layperson. There is another book that I will be referring to in my notes that is much more designed for like students, medical students, and things like that. But this one is done in a way that makes trigger point therapy accessible for you and me. So what is it? I'm sure you're wondering. From the Myofascial Pain and Dysfunction, the Trigger Point Manual by Drs. Janet Treble and David Simons, the definition for trigger points is a highly irritable area in the muscle tissue. Usually it feels like a nodule, a knot, a lump, but by definition when you press on it, it hurts. It hurts like the dickens. And it is responsible for something called referred pain, which is when you have pain in an area that is not related to the area that causes the pain. So in my experience, that's exactly what it feels like. It just feels like a little round knot, usually about that big, a little knot under the skin on a muscle. And I have used trigger point therapy not only to heal my frozen shoulder, but I've also used it for tinnitus, because I have tinnitus, to get relief from that, as well as relief from heartburn. So muscle tissue is surrounded by a membrane called fascia. You can actually see this on a raw chicken leg. And this fascia can get tight and inflexible, which makes it more and more difficult to move that muscle, causing the muscle to then atrophy. And a good strengthening or stretching exercise program can help keep this fascia from tightening up, because when it does tighten up, that is how trigger points form. This tight fascia leads to something called sarcomeres, which are a molecular unit, and when they become overstimulated and they clump together. And when they clump together, this is the trigger point. So as I said before, by definition, they are painful. You'll know if you have one by feeling around the area. And, like if you're feeling around the muscle and you hit something that is like, oh, you'll know, you'll feel it. You'll feel like a sharp pain someplace where it shouldn't be. So treating a trigger point can help with myofascial pain, particularly, as I said, referred pain. And some examples of referred pain are low back pain, headaches, migraines, joint pain, and joint stiffness. So this manual teaches you the technique. It also shows you, here's like a page right here, where the trigger points are located for your particular pain. So I will show you where I found trigger points for the frozen shoulder for tinnitus, and then I'm going to actually do the technique on, I found the other day a trigger point, an active trigger point, because obviously when you treat them, you deactivate them, those sarcomeres dissipate, and the area starts to behave like normal. But I found an active trigger point, so I'm going to treat that on camera so you can see what that looks like. The technique, in a nutshell, is a slow stroking massage. You do the massage in one direction over the trigger point, and you massage anywhere from 6 to 12 times. And you do this anywhere from 6 to 12 times a day. More is not better. More, in fact, is counterproductive. You don't press really hard, and you try to keep your pain threshold level to about a 7 on a scale of 1 to 10. So it's going to hurt, but you should be able to handle, easily handle the pain. So areas for a frozen shoulder that I use to treat my frozen shoulder are here on for me, the active trigger points that I found were across my scapula here in the back, which is the scapula is this flat muscle, this flat bone right here, and then there's a sheath of muscles over it. You can see by moving this way, I'm moving my scapula on this side. And the way that I would treat it is I would get a ball, a tennis ball, and put it in an athletic sock. I would then stand next to a wall, use the sock to get the ball over the trigger point areas, and then gently move back and forth across until I found the trigger points, and then massage them that way. The first time I did it, I got lightheaded. I got nauseous. My legs became weak and went out from under me. Fortunately, I was against a wall, so I just slid straight down the wall and sat on the floor until that feeling of lightheadedness. I thought I was going to pass out, honestly, the first time. But I didn't. And once that, feeling went away, I was able to continue treating and, was able to address the intense, because if you have a frozen shoulder, and if you like, I can do like a separate frozen shoulder video, because I know that there are people that have it, although it's rare. So it may not be something that you have experience with or have a relative that has experience with, but it's usually something that occurs as a result of an accident where the shoulder has to remain mobile or gets injured or something like that. Anyway, the point is that it's incredibly painful. It's called adhesive capsulitis, and the shoulder locks down, basically, so you cannot lift, you can't, that's how you raise your shoulder. You cannot get your arm up, you cannot get your shoulder up. And it can last anywhere from 6 months to 2 years in this locked, frozen state. So the trigger point therapy, my first frozen shoulder lasted 9 months, from freezing to thawing. And during that time, pain management is the first treatment, because it is incredibly painful. Even just to touch the arm will bring tears to your eyes. The pain is so intense. And that is where the frozen shoulder trigger point therapy helped, because it calmed down all that pain so that I didn't have to use pain medication for an entire 9-month period. I feel like it might have helped stimulate or trigger the thawing response as well. But I did do it. I came to it late in the process. I came to it at about month 5. But it was definitely a game changer for that. So that's the areas for frozen shoulder. For tinnitus, tinnitus depends on the cause. There are general areas that are found here, along the neck, along the face, that are recommended for tinnitus. I knew that my tinnitus was caused by sinus problems and allergies, And so I concentrated on those trigger points, or I found trigger points related to sinus. So what I would do is at night when it was so loud that I couldn't sleep, there's 2 trigger points here that I would massage, and there's a third one just up under the jawline. And by massaging those at bedtime, it would quiet the ringing. That's what tinnitus is, by the way. It's ringing in the ears. It would quiet the ringing so that I could sleep. Now, it would be back the next day, but it definitely is a tool that helped me get through the worst of my tinnitus symptoms, which aren't too bad right now. It comes and goes. Mostly it's gone, but it will occur just depending on sinus, weather, whatever. And then the last thing that I wanted to show you, and I'm going to back the camera up a little bit, is that the spot for heartburn and digestive issues, there's a trigger point along the abdomen, and I'm going to show you the massage treatment on that point. So let me back the camera up. Okay. All right, so here, yes, here is the trigger point, and we'll begin. I'm just going to begin by doing 6 strokes. 2, 3, 4, and as you'll see, 5, 6, and you can use 7, 8. Okay, and that's going to be enough. But as you can see, you don't have to apply a lot of pressure. Let me bring you back in again. So as you can see, you don't have to apply a lot of pressure. Again, it's going to hurt when you first do it, but from the first stroke, I felt that rush. It's kind of like the opposite of endorphins. Like if you get like an endorphin charge and you feel so good. Well, this is a release of something really bad that makes you feel really bad. It just sort of rushes through you and then it's gone. I don't know medically what that is. I don't know how to describe it. That's just the best way that I can describe how it feels. Last thing I want to talk about is fibromyalgia, because it's so common. And I know that I have viewers that have it, or that have family members that have it. And it can be a really, really tough condition to manage. So in that book, the Myofascial Pain and Dysfunction, the Trigger Point Manual book, the doctors that wrote that book said that fibromyalgia is thought to have its beginnings with trigger points activated as the result of an injury, an accident, repetitive motion. And in the book, Dr. Travell, who is the author, one of the authors, believes that many people who have been diagnosed with fibromyalgia are afflicted with widespread myofascial trigger points, in addition to the tender points that are a criteria of the diagnosis. So they are not the same. The tender points and trigger points are not the same, although there can be trigger points over or in adjacent to or in conjunction with those tender points. According to Dr. Travell, trigger point therapy, when done by a trained therapist, can be an effective way to deal with this pain, provided the massage therapist or trigger point therapist has the patience to limit the therapy to only what the sufferer can tolerate. So, because fibromyalgia is painful, but a trained trigger point therapy massage therapist, and I have been to one, and let me just quickly tell you about that experience. I went for my second frozen shoulder because as soon as I felt it locked down, I was not going to go through, like months and months and months. So I started with a massage therapist, and she used a machine that stimulated the trigger point without having to, and then later worked just an overall massage of the area. So if you can find a trained therapist near you, and you do have fibromyalgia, it might be something that is worth looking into. It might be something that can help you. So that's going to wrap it up today. I hope you found this video interesting. If you did, please give it a thumbs up. If you do have chronic pain and you have stories of how you've successfully managed it, I would love to hear from you in the comments, because again, it's something we're all going to have to deal with sooner or later if you live long enough, and sometimes it's sooner rather than later. Yeah, so again, I thank you so much, everyone, who for watching. I thank you for subscribing. If you haven't subscribed, I would love it if you did that. Just hit the subscription button followed by the notification bell so you won't miss my next video, which usually are on Tuesdays. And until I see you again in my next video, I'm wishing you a wonderful day, a wonderful week. Take good care of yourselves, and I will talk to you again very, very soon.